The Labor Day holiday weekend is almost here, and there are concerns about COVID-19 spread. Here to discuss that with us is Dr. Kristen Moffitt, an infectious disease physician at Boston Children's Hospital. Good to see you.
Good to see you too.
So we do typically see cases spike after holiday weekends. Do you have any special concerns about kids who may be heading into a classroom less than 2 weeks after Labor Day?
Yeah, it could certainly be a concern. Based on surges that we saw after Memorial Day and then again after the July 4th holiday, gatherings for Labor Day festivities could certainly be an opportunity for increased exposures if people aren't careful. And then the combination of this possibility of increased exposures around Labor Day and then having children who experience those exposures, who we also know may only experience very mild or no symptoms at all of this infection, coming together within the subsequent 2 weeks for in-person classes could certainly lead to increased cases. So we all need to remember that the path to being able to safely send students and teachers back into schools is to control transmission within the community as much as possible. So if families are celebrating Labor Day, it's not the time to relax the precautions that have been keeping us safe so far. So smaller groups certainly are better. Outside gatherings are better than inside gatherings, but maintaining physical distancing, masks if that can't be done, all of that would still be really important. And then continuing those practices when kids go back into school would be important as well.
What about for kids that are learning remotely? A lot of parents may be thinking about how that day is going to look at home. What is your advice in terms of like a recess, a snack time? How structured should this day be?
Yeah, I think that it's going to be challenging for everyone. So I think families really need to cut themselves a little bit of slack and do their best to set up a routine, but to not have too much stress over whether or not they are able to stick to that routine 100%. I think one of the most beneficial aspects of a full day of in-school learning for children is the routine. So to whatever extent possible, having the start of the day be around the same time, having a break for either snack or lunch or to get up and move around a little bit around the same time. To the extent that that's possible for families to keep that routine would certainly be helpful. Will probably make it more likely that the kids and the families who are home trying to get them through online learning can endure through this, but to not be too hard on yourselves if it's sticking to routines like that are difficult for families.
So just quickly, Dr. Moffitt, I want to ask you about the college-age kids. We have seen these images of people partying, not following these precautions. If you're a parent, how do you get your college-age kid to take these precautions seriously?
Yeah, I think one of the most important things we have to remember is what motivates college-aged people and what their priorities are, and understanding that they are socially and emotionally driven to interact with their peers at that age. So shaming college students for wanting to socialize or maybe even acting on that urge is not going to be helpful, and at worst may even make college students less likely to be honest about their activities, about their exposures, and about their symptoms. So probably a more powerful point for college students would be to make the point that their college campuses can only stay open safely if transmission remains well controlled. And so whatever they can do to contribute to control of transmission would be important for them to be able to stay on campus.
Yeah, get to what motivates them. Awesome point. All right, Dr. Moffitt, thank you for your time. We appreciate it.
Thanks.